And this is news that goes to the nation's fight against the coronavirus. Pfizer is officially asking the Food and Drug Administration to give emergency approval to distribute its vaccine to children aged 5 to 11. The agency will meet later this month to consider the request. It comes, of course, as COVID-19 cases among children have surged in recent months. That's according to data from the American Academy of Pediatrics. Kids make up more than a quarter of new COVID cases nationwide. In total, 56% of the U.S. population is fully vaccinated. Let us bring in Dr. Bob Lahita. He is a director at the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Bob, so if this goes through in the next couple of weeks, if this is approved, that will make at least some 28 million children eligible for the shots. How significant is this news?
This is so significant, Vlad. This is what we've been waiting for. So children between the ages of 5 and 12 will be able to get the shot. This will significantly decrease the option of a variant developing with further infection of children. You know, children don't get very sick. Some of them do because the numbers are increasing now, but by and large, they don't get very sick. And this will be good news for teachers, particularly, and for parents, who now can feel that their children are protected. They won't have to wear those masks with such assiduous ways that really are bothersome for children.
You know, recently, Dr. Anthony Fauci was asked whether or not he thought we would be able to gather for Christmas, and he said it's a little too early to tell. Former FDA Commissioner Scott Gottlieb said yesterday that the pandemic phase of COVID-19 could be nearing the end. And he was really referencing the approval of Merck's antiviral COVID drug and also the news about vaccines for children ages 5 to 11. What's your take if if these medications and the vaccine, if they manage to become available, do you think we could be seeing the end of the pandemic phase of this?
Yes, I do, Anne-Marie. I think that the pandemic will end. And I think we see more than light at the end of the tunnel at this point. We're attacking this virus from so many angles. Now children having a pill, and many pills are in development, oral agents that will help us control this pandemic. This virus may become endemic. It's going to be with us probably forever, but it's not going to be the way we know it. It'll probably something that will require an annual or maybe semi-annual vaccination to keep us safe.
Yeah, and after that interview that Dr. Fauci did with our Margaret Brennan on Face the Nation, I don't know if you want to use the word walk back, but he said that several people misinterpreted what he was suggesting. He said that he will be spending Christmas with his family, and he encouraged people, those who have been vaccinated, who are protected, to have a good, healthy, and happy Christmas. So that is good news that we're going to be coming, hopefully, out of the pandemic phase of this. We've also learned, Dr. Bob, that Los Angeles will now require proof of vaccination to enter several indoor businesses. People with medical and religious exemptions will be able to show proof of a negative test. Do you think that rules like what LA has implemented, what New York has implemented, are working? I will point out that throughout the course of this pandemic, and this is still knocking on wood, that I've never been infected with COVID-19, and I've worn my mask throughout the entirety of this, even when I was at the gym, and I still do that even now, although you're only able to go into the gym if you're fully vaccinated.
Right. Well, we want people certainly to be active. And if you're active, you're healthy. But, you know, if we're looking at the end of this pandemic, yes, mandating vaccines in New York City and now in Los Angeles are big moves that will guarantee that tens of thousands, maybe even hundreds of thousands more people will be vaccinated, because it's an annoyance to go to a restaurant and be told, well, I'm sorry, you can't come in here, you can't sit down because you don't have a vaccine card or you're not vaccinated. And as you know, you can use your iPhone now to show that you've been vaccinated. So this is a move that people don't like, but it is something, it's like, you know, the poor tasting medicine that's good for you, but you don't like taking it. It doesn't go down well.
All right, Dr. Bob Lahita, thank you so much. Appreciate it.
Thanks, Anne-Marie.